Now, whether you've been suffering from erectile dysfunction for the first time, or this is something that you've been dealing with as an ongoing issue, today we want to discuss what are some of the medications out there, the very popular ones, and which one is actually good for we men when we are suffering from erectile dysfunction. And so I'm going to put together side by side two of the popular medications, tadalafil, commonly known as Cialis, and then the other one is sildenafil, commonly known as Viagra. Now, you and I know that erectile dysfunction is a very sensitive issue, and so making the right choice for the medication will help women as we go through this phase of our life. Now, the statistics again shows that over 50% of men, actually 52% of men, as we age, will have one time or the other erectile dysfunction. So I'm putting two of those two medications together, and what we are looking at are the following criteria to see which one is the best one to use. I'm using four criteria. The first one is the efficacy of the medications. The second one is the duration of action of the medication. And then patient's preference and also the adverse side effects that its medications can cause. So the first one, the efficacy. Now, both sildenafil and tadalafil has been shown to be very effective for treating erectile dysfunction in male. Now, sildenafil has a short action duration, about 4 to 6 hours. So when you take sildenafil or Viagra, the onset of action is very, very quick. And so most men like that aspect of it because they want to have stronger erection very quickly to have sexual intercourse. Now, the dosage that has been proven to work very well for sildenafil is around 50 milligrams. 50 milligrams is the one that seems to be working very well, effective for most men. And of course, it comes with side effects as well, which we'll talk about very soon. And then tadalafil, which also give men stronger erection. Most men have found that a 10 milligram dosage is the one that gives them harder erection enough and to be able to have sexual intercourse. Now, talking about duration of action, the like I said before, sildenafil has a short duration of action, 4 to 6 hours, and so this is like a disadvantage to most men because some people prefer to have like a longer duration of action, like tadalafil, which has supposed about 36 hours, long duration of action. So when men take these medications, they sometimes they prefer that they would have a longer duration of action that will help them to be able to have sexual intercourse at any time they want within that time frame. But if it has a shorter duration of action, then you have to plan your sexual life so that the action does not wear out. That is why most men that were interviewed, which had there was a what do you call it, a randomized controlled trial, also meta-analysis, and a lot of the men actually said they prefer tadalafil to sildenafil, that is Viagra. But again, it's a personal preference, all right? So when they asked a lot of men which one they preferred, most of the men, personal preference, 71% of the men preferred tadalafil over sildenafil. That means 71%. That's a huge number, right? They preferred tadalafil over Viagra just because of the longer duration of action and also the side effect profile that experienced by this man was less severe than the side effect profile that was experienced by people who took the Viagra. The most common side effect on this medication is a visual disturbance, headache, and a flashing sensation. And with tadalafil, it has also some musculoskeletal side effect, pains, and aches that people experience. However, one thing that runs through the people who took the Viagra was that they said because of the shorter duration of action, the side effect profile was shorter. And so some men prefer that. So again, it depends on your preference. The thing about tadalafil is that you can take it on a daily basis, and this actually helps men who has like enlarged prostate. It also helps reduce the size of the enlarged prostate, and so basically you're using one stone to kill two birds. So most men with enlarged prostate like to take the daily tadalafil and the 10 milligram dosage, and that helps with the erectile dysfunction and also with their prostate size. So that's one thing that most men prefer, and also because it has a longer duration of action and can be taken on a daily basis. You can have sex spontaneously anytime with your spouse, and most men actually like that instead of trying to take Viagra, which has a short duration of action, and you have to plan your sex. And again, again, it's your preference. If you're somebody who like to plan your sex life, then Viagra might be the choice to go. There's somebody who don't have the time, and then when you get home, sometimes you're tired, but if you want a spontaneous sex, then tadalafil might be the choice to go. So these are the reasons why somebody will prefer sildenafil over tadalafil. So if you have used any of these medications, right, and you have really experienced some effect of it, or you want to share your experience with our viewers, this will be very, very good, because I think hearing from other men will actually help us to know which one we should choose. And also, if you have not subscribed to my channel, please hit the subscribe button, and also share this information, because a lot of men out there are really going through hard time with sexual dysfunction. And for us, this is very, very important. So again, I'll see you on the next video, and we'll talk more about more men stuff. I'll see you again. Bye bye now.